This is amazing that you're here with that weather out there. But, well, the first part of my talk, I've even got a timer going on here, is going to be something that each and every one of us can do. And then I'll show you where someone like myself or our colleagues in urology would step in. So we're going to talk about urge incontinence, or another term that we've got is overactive bladder. And the overactive bladder encompasses all of those things: urgency, frequency, urge incontinence, can't get there in time, and that getting up at night frequently. This is a significant problem. You can see here, compared to other illnesses that you deal with, that this is at the top. This is just a little slide that outlines how we go through, each one of us can go through in our office and evaluate these patients. So urge incontinence / overactive bladder. So we're just going to review briefly here the basic evaluation. I had one of my kids show me how to do this. And then identify conditions, you know, the old saying with the delirium, infections, atrophic vaginitis, anything that's reversible. And then can we establish a working diagnosis? Can you and I come up with, say, this sounds to me just like overactive bladder or urge incontinence. And based on those things, if we can eliminate reversible conditions, do this basic evaluation, and establish a working diagnosis, we can all initiate therapy. And that's what we're going to first go through here. The office evaluation, as I just said, is to, if we can come up with that working diagnosis. The conditions that can contribute to this, even though they're there, we still can initiate treatment. We may need to do other evaluations, such as the urodynamics, cystos, imaging, that type of thing. But we can still initiate the treatment while we're deciding if we need to do other therapies, other evaluations. The physical exam, again, it's always depending on your background. Now, mine is I'm sitting there and I'm watching the patient, how they come out of the change room, you know, if they're using a walker or they're in a wheelchair. This to me is a real telling sign that these people do have some kind of neurologic issue that, you know, even though we're not going to change it, we can still try and help these folks. The pelvic exam, along with the